Hi, everyone. Welcome to our TED Talk. We're doing this on breastfeeding and nutrition. I want you all to close your eyes and take a second to picture motherhood. What does it look like to you? What are the first things that come to mind? For many, it looks like smiles, love, pure bliss, new life, and breastfeeding. But is this the true reality of all mothers? Let's take a deeper look. Next slide. The CDC released a statistic that said 60% of mothers do not breastfeed for as long as they intend to, and you might be asking yourself why. What are the obstacles that mothers face when breastfeeding? Well, there's a common thread: excessive crying of the baby, difficulty latching to mom, acute illness of mom, etc. The list goes on. On top of these challenges, mothers tend to receive poor patient education from their provider and have low access to care, specifically in South Central LA. This can often lead to enthusiastic mothers who are left disappointed. So that's why our goal is to target and help mothers who are able and wanting to breastfeed to have better outcomes. One of our patients, let's say her name is Marcia, came into clinic for her 6-week postpartum checkup and was distraught to share that she gave up on breastfeeding a while ago. It was her first child, and she had been previously very excited to breastfeed. She shared that the baby was not latching on properly, and it left her feeling disappointed as a new mom. Unfortunately, Marcia is one of the many mothers who share the same story. Our project is aimed at mothers just like Marcia who just wish and are able to breastfeed but are unable to do so. Next. So we've discovered this problem. Now what? After conducting some research, we as a group determined that the problem did not lie on the breastfeeding mothers. We needed to dive deeper. We realized that the root cause of this problem in South Central LA was that the providers were lacking in knowledge and confidence regarding lactation. And when the providers feel this way, the care that is extended onto their patients also lacks. So what do? We educate the providers. So that was our target audience for improving breastfeeding outcomes in South Central LA.
According to the American Academy of Pediatrics and World Health Organization, the current guidelines recommended exclusive breastfeeding for approximately 6 months, followed by continued breastfeeding with complementary food for at least 2 years and beyond as a mutually desired. Our group's focus was to educate individuals about breastfeeding and proper nutrition, ultimately with the goal of helping individuals achieve their goals while in compliance with the current guidelines. According to Healthy People 2023, around 25.4% of infants are exclusively breastfed through age 6 months. The current goal is to reach 42.4% by 2030. Zooming down to focus on our specific population, SPA 6, South Central LA, per statistics from the LA County of Public Health, we found that although 88.2% of mothers initiated breastfeeding, only about half would continue through at least 6 months. After speaking to a community leader and a healthcare professional who works in our community, we decided on our objectives. While creating our project, our objective was to increase the knowledge and confidence levels of healthcare team members and patients in regards to breastfeeding and nutrition. We decided to do this via lunch and learn for the healthcare team and a pamphlet for the patients. While providing information, our goal was to ensure it was effective, concise, culturally competent, accessible, and incorporated health literacy. During the lunch and learn, we first performed a pre-survey to assess the knowledge and confidence regarding the subject matter. Then during our presentation, we spoke on why women stop lactating, cultural perceptions on lactation, education points on nutrition, lactation, and pumping. After the presentation, we conducted the same survey again to reassess the viewers' knowledge and confidence level regarding the subject matter. In regards to a pamphlet, we provided it in both English and Spanish. We strive to use language that would be digestible to those who do not have a medical background or advanced reading level via a process called SMOG. We also took into account our specific community and what resources are available to our target audience, such as incorporating CalFresh and Thrive Market.
In the community of South Central LA, breastfeeding isn't merely a choice, but a tradition of culture, which is passed down from one generation to the next. Yet amidst this cultural reverence, we confront a paradox, and where surveys are revealing the clash between cherished traditions and the stark realities of adapting to life in the United States. Participants, while valuing breastfeeding as the healthiest choice, are now grappling with societal perceptions and financial pressures. Here we confront a critical juncture with health literacy and cultural humility intersect. Understanding the nuances of heritage is not just a matter of cultural sensitivity, but the cornerstone to effective care. Next slide. Our project, grounded in the deep understanding of these complexities, embraced a holistic approach. Our research demonstrated literacy rates as high as 85%. However, per CDPH, 41.6% of adults in our community had below a high school education. So our group felt this information was important to share to emphasize not only the need for educational content, but also the need for easily digestible information. Our group discussed the need to keep information plain without the use of medical jargon, while also emphasizing a teach-back method to ensure their understanding. When discussing the intervention, we also advised to include pictures for quick referencing, and as was previously shown, a smogged flyer infographic for providers to use as a tool for discussing these topics. Next slide. We've engaged with our community not as a passive recipient, but as an active participant. Approaching nutrition as a mother can be a very challenging practice and can sometimes be a big life adjustment. And so for these reasons, we emphasize the need for patients to be able to make informed decisions while teaching providers to be more confident engaging with their patients in conversation, to provide both evidence-based information that's both practical and factual. But what are the results of our project? Now let's turn our attention to the pre and post survey findings.
Okay, so when we did perform our pre and post survey, we were working with providers on site at South Central Health Center. That included DOs, MDs, PAs, and MAs that were within the Women's Health Department. Our four main questions, I can go ahead and list, but they were all working on a confidence level score of 0 to 5. Our first question was, how confident do you feel in giving education on breastfeeding nutrition to patients? Our second one was confidence in giving education on pumping to patients. Third was confidence in giving culturally inclusive information on breastfeeding nutrition to patients. And 4 was how likely they were to start a conversation about breastfeeding nutrition and pumping with patients before delivery. We had 2 other questions not listed in the graph. We were asking if they were already giving resources regarding breastfeeding nutrition and pumping. To list that, all providers listed that they were just doing talk education from previous medical knowledge, but nothing new, which was our 6th question, which was asking if they've learned any new information regarding breastfeeding and pumping in the last 3 months. Prior to our intervention, no one had learned anything new in the past 3 months. We thought this was important when considering our intervention and timing. And as you can see, we've had a wonderful increase in knowledge from our provider education. We really believed that providing information to providers was a more sustainable effort due to the spreadability of information. By increasing their confidence in educating patients, we could reach more patients and provide the pamphlets in both English and Spanish to make the education accessible to their population. Providers were previously just giving the verbal education when giving information regarding pumps. However, they had no visual or written education for patients, which is again where the pamphlet was a great sustainability effort on our part.
So I want to reiterate the objective of our group, which is to increase the knowledge and confidence levels of the healthcare team members in educating patients about breastfeeding and nutrition. It's evident that we have met our goal as shown on the pre and post test results that Claire just mentioned. There are 3 points I do want to talk about in our analysis of this project. So number 1, we definitely reach our target audience of providers, especially having done the project at South Central Family Health Center. We wanted to target breastfeeding mothers that are especially in like a food desert and may not have the complete knowledge on the importance of breastfeeding, as well as the nutrition aspect while breastfeeding. This clinic's patient population has just that, so we were able to deliver our message through the providers there and reach our target patient population. Point 2, as you can see, we made a pre and post assessment based on numerical scale 1 through 5, assessing the level of confidence that providers feel in delivering breastfeeding education to their patients. The pre-test result averages around a score of 3, 3.5, where the post-test, there's an increase in score going up to 5 out of 5 in the provider's confidence level. in providing the education to their patients. And number three, by tailoring our educational material to fit the clinic's patient population, like Kai mentioned, making it more concise, culturally competent, accessible, and incorporating health literacy by providing it in both English and Spanish. We made it easier for the providers to distribute the material and for the patients to actually understand the material. Towards the very end of our lunch and learn, Sarah, who is the PA there, she mentioned that when patients come in for their prenatal follow-up, they usually obtain their breast pumps from the clinic around 33 weeks. And because they now have the pamphlets, she mentioned that the clinic will print them out and hand that to each patient with the breast pump. I think our work has definitely created an impact on the providers, which is then passed down to the patients. This is the outcome that we had anticipated, as the providers now have the tools to make sure their patients get the support and information they need to achieve a successful breastfeeding experience.
So upon reflection of our entire project, our group was able to identify several barriers and strengths which tie into our Star wish for our project. First, our pre and post test results did show that the information we presented to providers at the Lunch and Learn helped boost their confidence level of providing information to patients regarding breastfeeding, nutrition, and pumping. An important obstacle to note that we had to overcome in our research is that it had to be tailored in order to address a patient population that was in a food desert area. So in order to overcome this barrier, we made sure that any nutritional recommendations we made were realistic for providers to recommend and for patients to obtain. And given the boost in providers based on our data, it does show that we adequately addressed this barrier and conveyed our research efficiently. Another obstacle to note that our group had to overcome was that we wanted to provide the clinic with resources to give to patients. However, given the clinic provides care to individuals with limited resources, we recognize that providing this information electronically may not be realistic, given that some patients may not be able to afford mobile devices or computers or have access to them. So we created the tangible informative paper pamphlet that could be handed to patients upon education. And like Tina mentioned, by supplying the clinic with this breastfeeding nutritional resource and breast pumping guide, the clinic informed us that they'll be including the pamphlet in a larger research patient packet for breastfeeding mothers. And the providers expressed a lot of gratitude towards us for creating this because it equipped them with extra tools to make sure that their patients receive the proper nutritional support and information regarding breast pumping to allow them to have the most successful breastfeeding experience. Our overall wish for our project was that we would have liked to do this Lunch and Learn in person instead of a virtual meeting. It was very difficult to schedule an in-person meeting with the clinic due to the provider obligations and conflict with our schedules as students. And as a group, we believe that the information provided in our presentation would have been more engaging in person, but we felt the providers still greatly benefited from it via Zoom. We had a small number of participants attend our virtual session, but we would have possibly had more if we had held the meeting in person. But on the bright side of things, all participants did adequately complete the pre and post survey in a timely manner. So we believe it was accurate representation of their knowledge from the session. And altogether, we believe we provided a very valuable experience to a small group of providers and that our intervention will have a large impact on the breastfeeding population within the clinic, and that we also were able to actively utilize the skill flexibility in our efforts to schedule a provider information session to achieve our goal. Next slide. And so our greatest takeaway from this project was really our effort to bridge the gap in resources available for those who come from an underserved and underprivileged community, as well as highlight that equity is really of the utmost importance in these communities. We wanted to specifically target the breastfeeding nutritional needs along with breast pumping education of those who come from a food desert area in order to recognize that although their means of nutritional sources may differ, these patients still deserve the proper resources to achieve the same end goal of successful breastfeeding experience as other communities do. The long-term goal of our project is really to empower breastfeeding patients to make the best nutritional decisions that will benefit both themselves and their babies, and to also allow patients to feel more comfortable with breastfeeding by receiving educational resources regarding overall lactation and pumping, thus increasing the rate of breastfeeding mothers altogether. But really, in order to instill the confidence and comfortability of this information in patients, confidence and comfortability must first be instilled in providers to provide this education. We saw firsthand both the enthusiasm and gratitude that the providers had when they participated in our presentation. And really, our hope is that more providers will not only feel comfortable to have open discussions about the difficulties behind breastfeeding, but also feel comfortable to provide breastfeeding patients with the proper education and resources to alleviate these difficulties, such as nutritional intake and proper pumping techniques. And next slide. And that's all from us. Thank you so much for listening to our TED Talk.